50 million Americans suffer from chronic pain. Sometimes even the most potent pain relievers don't help, spurring doctors and patients to look elsewhere for relief. Health and medical correspondent Sarah Lee Kessler reports that's increasingly the way doctors are turning to psychologists.
You almost sound to me like you're being empowered.
Ridgewood psychologist Peleg devotes much of his practice to chronic pain patients like Diana Albanesius.
When you have stress, the pain level is always much higher. And now it doesn't seem to be as bad anymore.
Albanesius, who saw Dr. Peleg for a year for help with shooting, burning, chronic leg and back pain after being hit by a car, wasn't getting enough pain relief from either medication or the spinal cord stimulator inserted into her lower back. Her doctor, anesthesiologist Michael Umanoff of St. Joseph's Regional Medical Center, referred Albanesius to Dr. Peleg and the psychological group of North Jersey. Dr. Umanoff says a psychological approach to pain management often helps.
I think it's the element of distraction. I think it's shifting one's focus, enabling a patient to really come to grips with their situation.
And the number one message of psychology is you are not alone. We understand what you're going through. Talk to us about it.
Why does talking therapy help? Because, Dr. Peleg says, invariably, patients who suffer chronic pain also suffer from depression.
What would increase depression more than feeling hopeless? And if you deprive a patient of hope, you're depriving them of almost anything, everything.
Psychiatrist Charles Carluccio says antidepressants often lessen chronic pain. Biofeedback, group therapy, and even a simple nuzzle from Mia, Dr. Peleg's dog, can also be helpful.
You're such a good girl. Yes, you are.
We have no grandiose ideas of being able to magic wand the patient and they leave with no pain. It rarely happens. In fact, it doesn't happen. But our job is to make the patient feel better.
Dr. Umanoff says the psychological approach to pain management is an important adjunct to what he does.
What percentage of your patients do you refer on to a psychologist?
If we could do it, I would like to send 100% of them.
Between the two, with the mind and the one working on the medical side of it, that's what anybody needs.
Dr. Peleg says for many patients, the feeling of being in control of their pain helps to relieve it. Sarah Lee Kessler, NJN News, Ridgewood.